Hi there, my name is Hunter Smith. Today I'm going to be talking about health informatics strategies to minimize medication errors. So, to summarize what will be discussed in this PowerPoint, we're going to talk about what are medication errors, we're going to explain health informatics, we're going to do a literature review, discuss all the literature presented, and then I will wrap everything up and conclude at the end. So to start, medication errors are a significant healthcare issue that can cause harm to patients, increase healthcare costs, and even cause death. So there are more than 6.5 medication errors per 100 admissions in acute care, and medication errors are thought to cause 1 in 131 outpatient deaths and 1 in 854 inpatient deaths. So they're pretty prevalent. These errors can occur in various forms, such as prescribing mistakes, omission of medications, incorrect doses, wrong medications, incorrect timing, incorrect route of medication administration, adverse drug interactions that weren't taken into account, compliance errors, and failing to take renal and liver function into account before prescribing certain medications. And all of these errors affect both the inpatient and outpatient care settings. So, what is health informatics? Health informatics is the integration of healthcare sciences, computer science, and information sciences. They can offer solutions to healthcare issues by using systems that manage and communicate healthcare data effectively. So some examples of this would be an electronic health record, a patient portal, healthcare databases, or the MAR, which is the medication administration record. So what are some ways that we can prevent medication errors and adverse drug events using health informatics? One of the big ways is medication reconciliation. So this is ensuring accurate medication records, particularly when it's performed by pharmacists and when those pharmacists are using medication databases. It's shown to reduce errors in hospitals. There's the clinical decision support systems. So these are usually embedded into electronic health records or MARs, and it can alert healthcare providers about potential medication risks and improve order accuracy. There's also barcode medication administration. So that is, scanning the patient, scanning a barcode. It all gets transferred into the medication administration record. And while this is effective, the systems are prone to errors if not properly followed, such as not scanning the barcodes, technical issues, or anything of that nature. So while it is effective when utilized properly, a lot of times errors occur because it's not used properly. Then there's e-prescribing. The use of electronic prescriptions has proven more reliable than paper-based methods, though barriers like technical difficulties and user acceptance still do exist. Patient education is also extremely important. One of the only causes for medication errors at home for pediatric patients is a lack of knowledge among parents or caregivers. So, especially in the home setting, educating patients or caregivers about proper medication administration can reduce errors. You can also utilize telepharmacy or web-based consultations. These have been shown to be effective. And also utilizing the patient portal that most healthcare systems have now could provide remote and real-time patient education for parents, caregivers, or even patients in the adult setting. And medication error reporting. It's extremely important, especially because it's thought that medication errors are reported only 26 to 33% of the time. So this limits the opportunities for root cause analysis and improvements in practices. Root cause analysis can identify problems that led to the error without blaming a particular individual or group. And you can develop an action plan from that to prevent future medication errors. So who is affected? There's really a widespread impact. So not only patients, but also healthcare providers, hospital systems, insurers, pharmacists, and really all of public health um, is impacted. And medication errors can impact patient outcomes, hospital stays, and overall costs. Unfortunately, medication administers. This is usually the nurse, and they're usually responsible for errors in the inpatient setting because they're administering so many medications. And unfortunately, these errors can decrease confidence, trust in healthcare, and job satisfaction. Prescribers are thought to be accountable for more than 25% of medication errors, which I found to be very surprising. And this can obviously result in financial and professional consequences. So preventing medication errors can improve clinical outcomes, patient satisfaction, healthcare costs, and reduce worker burnout overall. And it also contributes to $37.6 to $50 billion in healthcare costs annually. This means a 10% reduction could potentially save $10 billion every year. So patient education, prescriber and administrator education is all very important. So to conclude all of this, medication errors affect multiple groups of people. It's still a serious issue within healthcare. Healthcare informatics systems can offer solutions to the problems that we're facing, and reporting med errors and patient education are considered very effective in the prevention of medication errors. So that will conclude the PowerPoint. Thank you for listening, and I'll see you again soon.